Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer. I'll be joined shortly by my colleague and co-host, Dr. Kelly Kam, who's an epidemiologist by training. We're both college professors here at Michigan Tech University and members of the Health Research Institute. We want to formally welcome all of our viewers tonight that are joining on the Zoom webinar and on Facebook Live, and all the listeners out there tuning in on 97.7 The Wolf and 99.1 WIKB down in the Iron River area. It's great to have you with us tonight. We'll be focusing on health and well-being during the COVID-19 pandemic and beyond as we move forward throughout the rest of the year here. We have a great lineup of speakers tonight and we'll introduce them momentarily. But first, I want to recognize our sponsors for our Town Hall series. Those include the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, the Physiological Society, and once again, our presenting series sponsor, UP Health System Portage. We also need to recognize the Health Research Institute and their support, especially Dr. Karen Helt, their director. Their mission is to support health-focused research, education, and outreach here on the Michigan Tech campus and in the broader rural community of the Upper Peninsula. They've really been instrumental in helping us provide the platform for the Town Hall series. So thank you again to the Institute. The goal of each town hall is to help increase awareness about COVID-19 and how it impacts your health and that of society. I want to remind everybody that tonight is our 17th town hall. We've started this back in September. If you missed any of our previous town halls, for example, last month, we focused on environmental health and how the pandemic is impacting climate and all things environment related. You can go to our website, download these. They're free, they're recorded, and they're archived on our YouTube channel. That website is mtu.edu/health-research. Also want to emphasize that our town halls each Sunday, the subsequent Sunday, are broadcasted and re-aired on ABC 10 TV. Coming up this Sunday, you can watch that. Just to note, with the NBA basketball playoffs, we'll be starting just 30 minutes early at 11:30 a.m. Eastern. One other announcement to make. Many of you are aware about the Calumet fire last Friday evening. If you're looking to find ways to help support the victims in that, you can go to the Salvation Army website or call the Salvation Army in Hancock. With that, I have the opportunity to welcome in my colleague and co-host for tonight, Kelly Kam. Kelly, great to be working with you again. This isn't our first rodeo, so looking forward to tonight's town hall. And if you could take a minute and just set the stage for who's here tonight, introduce everybody, and get us fired up for tonight's topic.
Absolutely. So it's great to be back here again. As Dr. Elmer mentioned, so now that we have more and more people getting vaccinated, we are able to start to look forward and to think about what life is going to be as we get this virus under control, and not only locally, but worldwide as well. And so with that in mind, we have a variety of people because our lives have changed. Some for, there are some silver linings, but there's also a lot of things where we have to get back into the habit of living a healthy life. And what does that mean as we move forward? So we have quite a variety of people tonight with us. We have Kate Beer, who's the health officer of our local health department here, the Western UP Health Department, that services the 5 Western UP counties. We have Heather Grundy, who's a pharmacist at UP Health Systems Portage, to talk about vaccines. Hopefully he'll be able to join us. If he's able to, we have Dr. Zach DeYoung, who's a family physician in sports medicine for Upper Great Lakes Family Health Center. And then we also have Dr. Jason Bombard, who's a psychiatrist at Aspirus Ironwood Hospital, to talk about some of the psychological effects that many of us are experiencing, both from the infection itself, as well as moving forward of thinking about how do we get back to our normal lives. And then we are grateful to have 2 students joining us. So Jeremy Bagalki is a doctoral student in the Department of Psychology at Montana State University. So we're expanding our panelists a little bit wider here. Jeremy's going to speak about sleep and how our sleep has been affected and what we can do to get back into a good rhythm and a good sleep habits. And Isaac Wiedig, a doctoral student in Dr. Elmer's in my home department here in kinesiology and integrative physiology at Michigan Tech, to again talk about how important physical activity is during the pandemic and give us tips. I know personally I've been pretty sedentary, so I'm excited to hear about how I can get back in the habit of being a little bit more physically active.
Great. Thank you, Kelly, for that overview. I'm going to lead in with a question here. I just want to double check to see if we have Dr. Zach DeYoung on with us. I think he's here. I think his video is turned off. Dr. DeYoung, if you are there, feel free to turn your video on at any point. Kelly, just to lead in with a little bit more background, I know this question comes up all the time. Is the pandemic under control? Are we rounding the corner? Can you just provide some context with that, as I think that's a really good lead into our panel discussion for tonight?
Sure. So as a kind of as a background, so the only disease that we have eradicated is been smallpox. So as a public health and health group, we hope to get things eliminated in certain areas, reduce transmission, and get things under control. But it is not likely that we will eradicate COVID-19, but we hope that we can get it under control. And there are lots of different ways that we're able to do that, to get it under control. One of the best ways is certainly vaccination. And I heard a recent quote. I've been trying to find out who it was, and I cannot find out who it was, but it was a great quote that it's not vaccines that are the really key thing, it's vaccinations. So if you have a vaccine sitting there, it doesn't really do us any good. We have to get those shots in the arms. And so in the United States, I think we absolutely are starting to turn a corner across the United States. The drop in the 7-day average was about a 20% drop in new cases nationwide in the past 7 days average compared to the previous 7 days. So we definitely are seeing a decrease. We can't let up just yet. We're not there just yet. And certainly globally, we are miles away from being able to put this under control, particularly in certain countries, as I'm sure everybody's heard about in the news.
Okay, thanks, Kelly, for helping us get the town hall started. I just want to welcome in Dr. Zach DeYoung. Dr. DeYoung, I'll give you a little wave here. Glad we were able to work through the technical issues there, and you'll be presenting our third speaker tonight. So we'll follow up with you in a little bit. Next, we're going to kick things off and have Kate Beer from the Western UP Health Department provide a public health update to get us started. So Kate, I will turn it over to you.
You're on mute, Kate.
That's a good way to start, right? Thanks for having us tonight. This is a very good format to get information and have a good exchange and conversation of what's going on in our realm here. So from a public health aspect, you know, public health stood up to meet the need here, and it wasn't something that we expected or wanted to do, but not the way we wanted to be recognized, but it did happen. And, you know, we're very thankful that we have really good partners here in the Upper Peninsula, and, you know, we're able to stem the tide, I guess, and we didn't see a surge as bad as some of the other areas in Michigan. So right now, you know, if we think back over a year ago, the big message was non-pharmaceutical interventions, right? Where we did the wearing of the mask and the washing of the hands and social distancing. So that's really what we talked about, because there was no other solution other than quarantine, isolation, and these non-pharmaceutical interventions. Now we, as Kelly said, we are you know, lucky to now have some vaccines, some pharmaceutical interventions that we can start pulling back on some of these non-pharmaceutical items. So when we look to a path forward as far as what it means now to be in a world that has some level of COVID in it, because we will never, as Kelly said, eradicate it completely. So as we move forward, public health is dealing with and trying to determine what is that predetermined level of COVID that's acceptable within our society. And at what points and at what trigger points and at what levels then do we need to step in and be a little bit stronger with some of these non-pharmaceutical interventions, such as quarantine, isolation, putting the mask back on, those kind of things. So we're really having that discussion at the not only the local and state level, but even at the federal level. I've heard, you know, some discussion about, you know, what is it that we need to leave intact now that we've stood up this public health response. What do we need to leave intact to make sure that this doesn't get out of control again on us? The other part of that is, you know, we really saw that public health was somewhat unfunded at the beginning of this. So what have we learned from that, and what do we need to invest in public health going forward to make sure that we can meet the needs of our communities in the future? So, some of the things that, that we need to look at is, how has COVID affected our social determinants of health going forward, and how will that impact our public health and our society? And, what kind of a response is going to be adequate in the future? And then also what needs to be rebuilt. If you talk to a lot of the local public health entities across the state in particular, there were a lot of programs that we had to stand down in order to have the personnel to meet the response need at the time. And, we have a lot of rebuilding to do. As far as COVID will always now be part of our communicable disease repertoire, shall we say. It's the same now as TB or smallpox, as it were. So we really have to find out what that level going forward is going to mean to be effective, as far as making sure that our communities are safe, our schools are safe. Schools took a big hit this round. Our kids took a big hit within the schools. We need to ensure that those kids can stay in school. So really our path forward here is looking at what needs to remain and how do we deal with any outbreaks that may occur.
Thank you, Kate. A couple of questions for you before we move on to our next speaker. This question came in, the definition of fully vaccinated. Could you just provide some clarification of what that means? And especially that the little uncertainty here about the 2 weeks, and where does that come in?
Sure. So fully vaccinated means that depending on what type of vaccine that you have, whether it's the Pfizer, the Moderna, or the Janssen, that you're determined to be fully vaccinated or have some immunity to the virus after 2 weeks after your final vaccination. So for Moderna and Pfizer, those are 2-dose series. So you would be, considered immune or fully vaccinated within 2 weeks from your second dose. And then for the Janssen, which is the Johnson & Johnson product, it's a 1-shot dose. So you would be considered fully vaccinated 1 week from your single dose for that one.
Okay. Thanks, Kate. One more question. There's certainly some confusion on mask mandates and the updates from the CDC. Where do you recommend folks go to if they need clarifications? Do they go to your website, the state of Michigan, CDC? Where do they go to find out, when they need to wear a mask, when they don't, et cetera?
We do have links out on our Western UP Health website. CDC, of course, is a great place to go for general guidance. The state-specific guidance, of course, would be on the state's website under the epidemic orders. And the epidemic orders have just been updated, and they are effective for June 1st.
Great. Thank you, Kate. We'll come back to you with more questions in a little bit. Next, we want to welcome in Heather Grundy, a pharmacist from UP Health System Portage. Heather, good to see you again. Welcome back. I know it's been a few months. You were here with us in January when we talked about really early on the vaccine rollout. So I know you have some updates for us, so I'll turn it over to you.
Sure. Thank you so much. And thank you for inviting me back to speak about COVID vaccines. As it is exciting that these vaccines have been developed to help us fight the virus and provide protection for ourselves, our families, and our friends. My goal is to give a general overview as well as hopefully answer some common questions I have been asked as information is evolving as time goes on. So first, I want to quickly review how the COVID vaccines help protect us from the virus. These vaccines are known as mRNA vaccines, and they work by giving our bodies some material from the virus to help our immune systems make cells that will know how to fight the virus. With any kind of vaccine we receive, our immune system will make memory cells that serve as a plan of attack against the disease that we were vaccinated against. So to be clear, the vaccine components do not alter our DNA. And in fact, they do not even enter the nucleus of our cells where our DNA is. So this is a myth that I want to assure you it is not how these vaccines work. Next, I wanted to review what vaccines are available and what some of their differences are. And as Kate touched on, we have some that are a 2-dose series and one that is only a single dose. So the Pfizer vaccine is a 2-dose series vaccine, and that is indicated for those 12 and up. And this age expansion was recently approved by the FDA. The Moderna vaccine is also a 2-dose series that is currently indicated for those 18 and up. However, Moderna is currently seeking FDA approval for 12 and above. And so hopefully we will see that approved very soon. So I would recommend that you keep your eyes and ears open for that. Lastly, the Johnson & Johnson vaccine, or the Janssen vaccine, is also indicated for 18 and above, and that is a 1-dose only vaccine. So as Kate mentioned, I do want to emphasize that it is very important to get the second dose if you received the first dose of either Pfizer or Moderna, because you are not considered fully vaccinated until after that second dose. So while the first dose begins the process of building immunity, the second dose is absolutely necessary in order to receive the full benefit. And for all 3 vaccines, you are not considered fully vaccinated until 2 weeks after the last shot. And as with any vaccination, there is the potential for side effects. All 3 of the COVID vaccines have very similar side effects. And that can include some pain at the injection site, some redness or swelling in the arm, as well as body aches, headache, chills, and fever. But these side effects mean that your immune system is working, and they typically last 24 to 72 hours. However, if you do notice that these side effects are worsening or worrying you, then you should call your doctor. So to date, over 258 million doses of the COVID vaccine have been given in the US, and the data strongly supports the fact that they are safe and effective. Most people are eligible to get the vaccine as there are very few limitations. So those who should not get the COVID vaccine are those who have had a severe allergic reaction, such as anaphylaxis, after a previous dose of the COVID vaccine or to any component of the COVID vaccine. Other than what I just mentioned, it is okay to get the COVID vaccine. And as always, I recommend that you talk to your healthcare provider if you have any other questions. And as I previously mentioned, information is constantly being updated surrounding COVID. And I would like to touch on some things that have been recently released, as well as common questions that I have been asked as a pharmacist. So the first thing is there is no need to separate COVID vaccines from other vaccines. Giving the COVID vaccine at the same time as other routine vaccines does not change the effectiveness of the vaccine. Second, you do not need to wait any specific amount of time to get vaccinated if you have previously been diagnosed with COVID. As long as you are not in a quarantine period, it is perfectly safe to get vaccinated. And just because you had COVID, that does not mean you are immune from becoming infected again. The vaccine offers greater protection than having the illness. Many people have also asked what they should do if they are unable to get their second dose at the recommended time. And per the manufacturers, you'll want to get your second shot as soon as possible after your missed date, and there is no need to restart the series over again. I know there has also been some discussion surrounding booster doses, but this is still being studied, so there are not any current recommendations or guidelines about that. I understand that I have touched on quite a bit of information in a short period of time, and some of the resources that I would strongly encourage you to utilize regarding COVID as well as vaccines are the CDC website, the MDHHS website, and some of our local resources such as Copper Country Strong, your local healthcare provider, or your local pharmacy. The vaccine is now widely available, and you should be able to very easily make an appointment. So I strongly encourage you to get vaccinated. So thank you again for your time.
Thank you, Heather. We had a question here from a community member. It's a really good question. I'm sure you've gotten this before. Can you just clarify and explain what makes the Johnson & Johnson vaccine different, that only 1 dose is required compared to the other 2 COVID vaccines?
Sure, that is a great question. And the most simple way that I can answer this is that is the way that it was developed and studied. So with all 3 of the vaccines, they did study different doses, different timing, things like that. And this is what has been approved to be safe and effective by the FDA.
And then Heather, one more question. If we have a family member, a loved one who is hesitant about getting the vaccine, what advice do you have?
I talk to a lot of people in my own personal life that are hesitant to get the vaccine. And I explain to them that it is far riskier to get COVID than it is, and to be afraid of any of the side effects of the vaccine. As I stated, we have, given millions of doses of this vaccine, of all three of the vaccines. And, we are seeing very, very few side effects or serious adverse events from them. So overall, they are very safe and they are effective in helping to prevent the illness. So I would just strongly advise people to consider, the risk versus benefit for themselves.
Thank you, Heather. We'll come back in a little bit when we open it up to the entire panel. I just want to remind folks that we're here tonight for our COVID-19 Community Town Hall. In case you're just joining us, our topic tonight is focused on health and well-being during the pandemic. And as we look ahead, our presenting series sponsor is UP Health System Portage, and we have an all-star lineup of speakers here tonight to provide information and answer questions. On that note, if you do have a question for us, there are two ways to send it in. If you're on the Zoom webinar, you can use the Q&A button at the bottom and write in your question. If you're out there listening on the radio, for example, you can email your questions to us at townhall2020@mtu.edu. Final thing, if there are any radio listeners that are just joining us on 97.7 The Wolf and 99.1 WIKB, if you'd like to see some of the visual content, you can hop on over to thewolf.com and click on the links to join us on Zoom or on social media. So moving along, next we're going to welcome in Dr. Jason Bombard, who's a psychiatrist with Aspirus over in the Ironwood area. So Dr. Bombard, welcome back to our town hall. It's also been a couple of months. You were here in February, and I know you're going to talk to us about mental health during the pandemic. So welcome back and take it away.
Thank you very much for having me back. I'm very happy to be here to talk a little bit about this subject. And I wanted to talk about two separate things, one for people in general and one for people that specifically had COVID, because there's really two things as far as mental health concerns going on right now with this. As a psychiatrist, I think one of the things that I've always stressed is getting people to live normal lives. One of the biggest things that I've always pushed for with my patients was to get them out of the house, get them out in public, get them around people, socialize, do those things that everybody wants to do. That's the best way to fight depression or anxiety. And unfortunately, for the last year, that's exactly what we've been telling everybody not to do. And it's been a real struggle to get people back to where they even were before this had happened. I've seen many patients that have almost used social distancing as an excuse to go back into a safer place for themselves. And unfortunately, that's not a place that we want them to be forever. And coming out of this epidemic, we really have to figure out, how are we going to move forward? How are we going to start living our lives again? When is it safe to go back out and do all the things that we wanted to do? And that's not an easy question for a lot of people to answer, but we do have to start moving towards that. And getting those first steps in is probably the scariest part. I've told people a lot of times, they use the term baby steps, and I think that's what we need to do. We need to those people that haven't left the house in a year need to start going out a little bit. Don't go to a concert, maybe don't go to a big sports event, but go to the store when there's not very many people there and just walk around. Get back to living your normal life. Visit family. Check in on some of those people you haven't heard from in a year or so, because they may not be doing all right now. There's a lot of people that we've lost touch with that really need somebody to reach out to them and maybe get them pushed to get off the couch and get back outside again. This is something that isn't going to be easy for a lot of people, and when you add that uncertainty into it too, that's another thing that's really problematic. People aren't sure whether it's safe now, and I don't know when we will be able to tell people that it's 100% safe. Nothing's 100% safe in life. I think we always face risks every time we do anything, but this has been such a different situation for many people that it's really been a struggle to get people to believe us when we say it's all right to leave the house again. We look at wearing masks and all these other things that we do for a reason, and they do make sense that we're doing those things, but parts of our brain still sees that as, this is weird, this is wrong, this feels strange. So every time you go outside, you get that constant reminder that something's wrong in the world. And that's something that really does bring that anxiety to the forefront of us all the time. You cannot turn on the TV still a year later without the first thing you see being something related to death or dying or COVID or all the things associated with it. And that's not healthy. Now we need to get away from focusing so much on the negatives and look towards the positives more. Look at the numbers that are coming out of how we are doing really well. Some of the numbers that were presented with the changes in our weekly reporting and everything, we're doing good and we're getting better. And those are the things that we really need to start focusing more on. I think it's very important for people to look at resources for different mindfulness or just relaxation techniques. I think some of those can be very helpful. The Michigan State University Extension System is actually having a couple things in June and July. If you go to their website, you can find some of these things based on relaxation and mindfulness exercises, how to reduce anxiety through different techniques. There's a lot of other things out there like that. Almost all of the major hospital systems will have something on their web pages that give you links to some of these really great resources. SAMHSA, which is the Substance Abuse and Mental Health Services Agency, they also produce a lot of information on where you can go to get some help if you are feeling overwhelmed, if you're feeling like, I don't know how I'm going to do this. I don't know how I'm going to get back out there and live my life again. How am I going to get back to work when I don't know if my coworkers have been vaccinated? How am I going to go to the store if I don't know if that guy there next to me in line is a threat to me or not? And it's going to take some time, but I think we need to really work towards these goals. The other thing I wanted to specifically address was for the people that have had coronavirus. One of the things that we have started to notice more and more now is there does appear to be some degree of long-term, both neurological and psychiatric effects for people that have been infected with the coronavirus. In one large study by the Lancet, which is a large journal over in England, they looked at 236,000 people who had been infected with coronavirus, and 36% of them were diagnosed with a neurological or psychiatric illness after their infection. 12% of them had never had anything prior to that. So this is pretty significant. And it's not something that we would not expect to see. Most viral illnesses do have some period of either fatigue, brain fog, or other things after them. This is not unique to coronavirus, but in some cases it seems to be potentially a little bit more long-acting than some of these other viral infections have. There is a term now called coronavirus fog or brain fog due to coronavirus that is really starting to gain some ground. Now, I think a lot of people at first just said, oh, just a little bit of fatigue, a little bit, people's lungs are a little bit damaged from this and they're just not breathing right. And maybe that's why, or maybe they just, are still feeling a little bit sick. But it seems like even after full recovery from a physical standpoint, some people are having these issues, which include memory disturbances, difficulty with sleep, difficulty with mood, anxiety symptoms that are new. And we're really at the beginning of learning how to cope with these. We obviously don't have any medication specifically for these things. We do, we're looking at the idea of using some medications that we use for depression and anxiety, or even for ADHD as helpful measures in treating this. So if you do think that you are experiencing these issues after having a coronavirus infection, I would definitely say talk to your doctor. You're not alone. You're not making this up. This is a very real thing. Healthy living, I think the next few speakers are going to be talking a lot about these, so I won't go into the specifics of this, but diet, exercise, sleep, all of those things, those are absolutely key to recovery from this. And we've looked at some outcome measures, and people who do adopt healthier lifestyles do seem to come out of this brain fog at an earlier stage. So I obviously encourage people to be healthy anyways, but specifically if you've had this coronavirus infection, really take care of yourself and get yourself feeling healthy so you can fight off any of these long-term effects.
Okay, thank you, Dr. Bombard. I'm going to lead in with one question. I'm going to ask my colleague Kelly just to double check the chat. I know we have a couple coming in, so I'll ask one, Kelly, and then I'll defer to you on the next one. But Dr. Bombard, the pandemic has impacted kids, adults, older adults, students. Is there a group that you think is maybe more resilient that will bounce back faster? And then on the other end, which group are you most concerned about?
Well, I definitely think that kids are probably always going to be the most resilient of any group. I have 2 young children myself, and it's amazing how well they adapt to all these things. Obviously, it's been hard for some kids with the socialization aspects of school not being there, but most kids do really well with all of this. They're great. They're a lot stronger than we give them credit for sometimes. I think probably one of the groups that is at the most risk would certainly be the older adults. A lot of them were somewhat socially isolated to begin with, and because they were at the most risk for serious effects of the illness, I think some of them became the most socially isolated during this time period. They also lost a lot of what really meant a lot to them. A lot of them were involved in church activities or other social activity, even if it was just going out for coffee with some other people on a regular basis. And not having that was really difficult for them. I think a lot of younger people did the right thing by not checking in on their grandparents because they didn't want to get them sick, but that also left their grandparents alone. And I think a lot more of them have some of these depression and anxiety issues going on. The other problem with that particular group too is this is a group that from a stigma standpoint hasn't really warmed up to the idea that mental health is okay to talk about. A lot of older people, it's a personal weakness thing if you're feeling depressed or anxious. So it's going to be harder for them to get to admit it sometimes. So, ask them if they feel, don't seem right, talk to them about maybe this is something that we need to get you some help for, because it is a very serious issue.
I think we have time for one more question. Kelly, go ahead with the question from the chat.
I think actually your point about stigma is a great lead in. The question that came in from one of our listeners is actually exactly the same question that I have. There's so much stigma around being infected with COVID and the potential of having spread it inadvertently to other people, particularly because you are infectious for those 48 hours to 72 hours before you even have symptoms, know you're infected. Is there a possibility that some of these psychiatric problems or some of the depression or anxiety around this is related more to that kind of feelings of guilt or stigma associated with it? And how can we help people deal with that?
Well, I think that's absolutely true. I think we do have a lot of those issues around guilt, and so many people lost people also during this pandemic and weren't able to be there to say goodbye to family members, or weren't able to spend time with people that they loved in the last days of their lives. All of these things, and combine that with, like you said, how terrible would anyone feel if they were to have accidentally infected somebody that did end up having more serious consequences from this illness. And I think it's very important to remind people that there are things that are just out of our control too. And, I seriously doubt anyone would deliberately cause somebody to be ill. I think even a lot of the people who didn't take things seriously and then later on realized that because of that, somebody ended up getting sick, I think, came to realize that, okay, this was not the right answer. I shouldn't have done this. But again, they weren't doing it from a malicious standpoint, and they need to be reminded of that, even if you did something that did cause somebody else harm, that's not what you intended. And, we need to help you to understand that it's okay to feel guilty. It's okay to feel sad. It's okay to miss people. It's okay, to feel like, you let somebody down, but it's not okay to not try to do something to fix that now, whether that's, to help other people or to just even talk to the person that you may have felt like you have hurt in some way and remind them that you didn't mean to cause them any harm.
Thank you, Dr. Bombard. We're going to move on to our next speaker. Before we do, I just want to recognize our sponsors. We really appreciate their support: UP Health System Portage, Aspirus, along with their Iron Area Health Foundation, the MTech Smart Zone, Upper Peninsula Power Company, and the Physiological Society. Moving on, now we're going to welcome in Jeremy Ligulke, who is a doctoral student in psychology at Montana State University. He's also a Michigan native and an MTU alum. So Jeremy, good to see you again. Hope you're doing well. And I know you're going to tell us more about how the pandemic is impacting potentially sleep and sleep quality. So Jeremy, welcome and take it away.
All right. Well, hello out there to everyone tuning in. First of all, thank you, Dr. Cam and Dr. Elmer, for inviting me to speak. So our lab's primary research focused around sleep regulation and detriments caused by its dysregulation. So as I'm sure you already know, sleep is very important for numerous bodily functions, including immune activity, cardiovascular regulation, and mood maintenance. Now, while insomnia and sleep-related disorders were highly prevalent prior to COVID-19, since the onset of the pandemic, we've observed an even higher level of sleep dysregulation, which some have since coined coronasomnia. Mounting anxiety and worry, financial or job strain, social isolation, circadian disruption, among many other COVID-related detriments, have all added to an exacerbation of the already high levels of sleep impairment in the general population. Now, it's also important to note that these effects may be felt more strongly by certain individuals. Some research from our own lab has shown that individuals with high COVID-related anxiety reported more insomnia symptoms, and further, reductions in total sleep time and sleep quality were associated with increased anxiety, indicating a sort of bidirectional relationship between sleep and mental health during this COVID-19 pandemic. And interestingly, our results also showed that females in particular experienced enhanced anxiety during the pandemic, underpinning disparities in the impact of the pandemic on mental health between sexes. Now, further research has also shown that sleep and wake times have shifted to later starts, indicating a pandemic-related changes to our sleep and wake rhythms. Now that we are starting to roll out vaccinations, as we've alluded to earlier, and are beginning to open back up, these schedule disruptions as well as ongoing uncertainty regarding COVID-19 still remain, which may be impacting your sleep even now. Now, moving forward, as we begin to approach a new form of normalcy, it's crucial that we take steps to improve upon any detriments in sleep schedule and routine that may have occurred during the pandemic. So first, it's important to set a schedule and a routine for bedtime and get up times. Make sure that you're winding down before bed and setting this strict routine that you'll follow, day by day. By maintaining consistent nightly routines, your body will begin to get back into a regular rhythm, which will ultimately assist in your sleep quality. Next, reserve your bedroom for sleeping. Without a schedule, as you might have experienced, given the social isolation and quarantines during the COVID-19 pandemic, it's pretty easy to lie around in bed, watching TV or playing on our phones. But keeping the bedroom as a place for sleep alone can hold benefits for sleep regulation by essentially training our brains to associate our bed solely with sleep, a relationship that may have been dampened during the pandemic. Further, take some time to get outside. Natural light serves as a key regulator of our sleep and wake rhythm. So as the summer is approaching, even in Michigan, make sure to take some time to go for a walk or even just sit outside. This exposure to natural light as well as activity during that time will help to tell your body that it needs to be awake and can subsequently improve your mood and your mental well-being. And additionally, if you find yourself feeling overwhelmed or stressed out, differing forms of relaxation techniques such as yoga, deep breathing exercises, meditation, quiet reading are all great ways to wind down and may help to improve those subsequent stress levels. And then lastly, stay in touch with friends and family. So as you've heard from Dr. Bombard, social connection is very important to mood maintenance, as well as mental health. To combat the effects of long-term social isolation that you may have experienced during the pandemic, make sure to reach out to loved ones and friends to foster connection during this time. This improvement in socialization and mood works wonders on sleep quality, as low stress is highly impactful on overall sleep quality and quantity. Now, by using these strategies as the country begins to reopen and, as I said, approach a somewhat normalcy, you'll hopefully be able to get back into the prior rhythm of your sleep schedule that you had prior to the pandemic, which will ultimately help your mental, physical, and emotional well-being moving forward.
Thank you, Jeremy. That really extended nicely upon what Dr. Bombard just discussed. So mental health and sleep, and pretty soon we'll be moving on to physical health with Isaac coming up in just a minute. During the pandemic, I also know that alcohol consumption increased. I'm wondering if you can talk about potential links between alcohol consumption and the poor sleep quality. And do you think this was a contributing factor?
Yes, absolutely. So alcohol is often used as sort of a self-medication for, stress, anxiety, depression, things along those lines. But it is not helpful. So it may feel that it's helping you sleep better, but in reality, what's actually happening is that alcohol is disrupting your sleep quality, as well as that consolidation of a good night's rest. So while it might feel like it helps you fall asleep a little bit faster, it's definitely not helping you in the long run. So I would avoid, looking to alcohol as a sort of self-medication during these times, especially for its impact on your sleep quality.
Okay, thank you, Jeremy. I just want to remind folks, if you do have questions, you can use the Q&A button. I do see some coming in. I'll ask my colleague Kelly to help me double check questions as they come in, and then I'm monitoring the email address here. For the sake of time, I just want to continue on. Next, we'll welcome in Isaac Wiedig, who is a doctoral student here at Michigan Tech in integrative physiology. Isaac, welcome back. You've been on the town hall a couple of times, and you'll be talking about physical health here, and physical activity specifically, and its role during the pandemic and potentially beyond. So Isaac, take it away.
All right. Thank you, Dr. Elmer, for the introduction. Thank you for having me back on again as well. It's always a pleasure. So since the start of the pandemic, our primary means of combating COVID-19 have really been through behavioral strategies that are geared towards limiting viral transmission or reducing the spread of the virus. And these strategies include the 3 W's, as they've been termed, that we're all very familiar with by now: wash your hands, watch your distance, wear a mask. And while these strategies are certainly very important and serve as sort of our first line of defense against COVID-19, a critical second line of defense, which has had a little bit less emphasis, is just improving our overall health and enhancing our body's ability to actually cope with COVID-19 if we do become infected. So meaning we have less severe illness and potentially faster and fuller recoveries. So one of the best ways that we can improve health is with regular physical activity. So we've known for quite some time now very clearly that leading a physically active lifestyle provides a number of robust health benefits. It can prevent and treat many chronic illnesses, including heart disease, hypertension, obesity, diabetes, all of which put individuals infected with COVID-19 at a high risk for severe outcomes. And we also know that it can decrease inflammation and bolster immune function. So very recently, there was a landmark study published by Salas and colleagues in the British Journal of Sports Medicine that reported a strong link between physical inactivity or a lack of physical activity and severe COVID-19 outcomes in 4,800 adults. And the major finding from this study was that patients with COVID-19 who were physically inactive were more likely to be hospitalized, admitted to the ICU, and die compared to those who were physically active. And furthermore, other than advanced age and a history of organ transplant, physical inactivity was actually the strongest risk factor for severe COVID-19 outcomes, even more so than a lot of the other factors that had already been previously identified, including smoking, high blood pressure, obesity, heart disease, diabetes, and even cancer. So at this point, we have pretty good data to suggest that aside from vaccination and basic strategies to mitigate viral transmission, engaging in regular physical activity is probably the single most important action that can be taken to combat COVID-19 and to manage the severity of the disease. In fact, experts, including the author of the study that I just mentioned, Robert Salas, are calling for health organizations to list physical inactivity as a risk factor for severe COVID-19 complications, just like advanced age and chronic illnesses. And additionally, they're pushing for public health officials to promote physical activity as a critical strategy to combat COVID-19. And this promotion is really important, especially right now, because data actually indicates that during the pandemic, people are moving less and sitting more than they were before. So we've actually seen a decline in physical activity levels at a time that we may need it the most. And as we move forward beyond the pandemic, it's important to also consider that these declines in physical activity may have lasting effects on our long-term health too. So it's going to take some time yet for vaccinations to reach levels of herd immunity, and thus it's still important that we remain vigilant and take the necessary actions that are required to keep our community safe and healthy. And this means promoting physical activity and trying to keep people active. So what we've proposed is adding a fourth W to the 3 Ws, which is walk to stay active. So simply reminding people to keep physically active in addition to continuing to practice hand washing, social distancing, and wearing a mask if you're not vaccinated. Another thing that we're really pushing for here in our local healthcare system, and experts are pushing for across the globe, is to establish physical activity as a vital sign of health. So when you go into the doctor, they routinely assess things like heart rate, blood pressure, your body temperature, and they use those metrics as indicators of your health. And given how important we know physical activity is, assessing an individual's physical activity level is another useful metric that clinicians could use to more comprehensively assess the health of their patients. And if need be, they can then prescribe patients physical activity as a form of medicine and refer them to community resources that are aimed at actually facilitating physical activity and exercise. And then just lastly here, I'll briefly mention a resource that myself and a team of graduate students at Michigan Tech have created. It's called Up and Moving, which is a free physical activity program for the Upper Peninsula. And with Up and Moving, we offer both live and recorded virtual workouts, which can all be done from home with no equipment necessary, and they're open for anybody to view or join. So this is a great resource if you're looking for ways to be more physically active yourself, and is also a great program for healthcare professionals to refer patients to as well. So if you're interested in learning more about Up and Moving, you can visit our website at upandmoving.org.
Thank you, Isaac. I wanted to build upon what you said, and Dr. Bombard mentioned the baby steps. There's a question that came in here. You know, I acknowledge I'm not as active as I was before the pandemic. I'd like to get going, but I'm not quite sure how. My routine is different. I might be getting less sleep. I might be a little bit more anxious. I'm dealing with a lot. What advice do you have? Where do they even begin? How do they start with those baby steps?
Yeah, I think the biggest key is set small, manageable goals. You know, you don't have to set aside an hour a day or even 30 minutes a day to engage in some type of exercise or activity. It could be 5 minutes. You know, maybe it's 5 minutes a day. Maybe only a couple times a week. So set yourself a small manageable goal that you can realistically achieve, and you can sort of build up from there. Once you're able to hit your, you know, maybe it's 3 days a week of 5 minutes. Once you can achieve that, then you can up your goal and push it a little bit higher. So I think sort of biting off small chunks and sort of integrating it into your lifestyle as a habit is the best way to go. And then with that, I'll say, try to find, you know, forms of physical activity or exercise that you really enjoy. So, I mean, if it's something that you like to do, you're more likely to get it done. My cheesy saying is fun exercise is done exercise. So, I mean, whether it's, you know, turning music on and dancing, or maybe you like to play, you know, sports, go shoot hoops for, you know, 10 minutes a day. I think those are the two things that can really help you start to integrate it into your life.
Isaac, just a quick follow-up on that. What about maybe less formal activities? If folks just aren't into playing sports, are there other activities that count towards physical activity?
Yes, so you don't have to look at physical activity as being like strictly, you know, formal exercise, like going to the gym, or I'm going to follow this workout at home. Any type of bodily movement, it counts. So, you know, doing chores in the house, sweeping, mopping, going outside and getting yard work done. All of those things count. So you can kind of accumulate some physical activity time, not just from the formal stuff, but just being up and generally just moving a little bit more.
Okay, great. Thank you, Isaac. I want to check back in with Kelly. I know we have some questions that came in from the Q&A button here on Zoom.
Absolutely. So I have a question for Kate. We have a couple people who have commented that they may be immunocompromised or live with someone who's immunocompromised. And as Dr. Bombard commented, that, you know, we can't control what other people are doing, and we can't necessarily control that they're vaccinated or not. What steps should someone be taking if they are immunocompromised to be able to be safely out in the world these days?
So I think, we kind of spoke to that when we said, what is the path forward and what is the acceptable level of COVID within the community? We still need to be mindful of the vulnerable populations and the need to protect them. Right now, I would strongly suggest that they avoid crowds. They, still continue to do the social distancing and wear a mask. Hopefully we can reach that herd immunity where it will be a little bit safer for them to go out and be about. I think that's a great question, and I think there's more to be learned about COVID first before we can really understand how somebody in that position will be able to move forward, with some level of COVID within our community, understanding that there will be some level. So right now, continuing to take those non-pharmaceutical interventions that we've talked about here is really the safest option until we get a little more vaccine into some more arms, for sure.
And so I think that also kind of brings to the point of that someone getting vaccinated is not only getting vaccinated to protect themselves, but also to protect the rest of the community. Is that correct?
Yes, that is one of the items that we've kind of pushed is, that what you're doing is you're protecting yourself and you're protecting your loved ones.
Thanks.
Great. The next question here is for Jeremy. This question is coming in from a community member on Zoom. So asking about the research study that your laboratory conducted, were the participants in the study also getting any more or less REM sleep? Can you just talk about REM, maybe define that for our audience and answer that question? Thank you.
Yeah, so REM is a very important stage of sleep. It's called rapid eye movement sleep. This is where your dreaming occurs, and it's very important for emotional regulation. So for something like COVID that may be associated with anxiety, depression, this REM consolidation is very important. Unfortunately, our study was all self-report measures. So we used, clinically relevant self-report questionnaires assessing sleep quality, quantity, as well as insomnia symptom severity. And I'm honestly not sure that there really is any research looking at, those gold standard measures of sleep quality that would allow us to establish a connection between COVID or the pandemic and REM sleep, unfortunately. But that is a fantastic question that has yet to be answered, unfortunately. But I do think that the changes that we're seeing in sleep quality in general may have some sort of impact on REM, which could then also further cause detriment to the anxiety and depressive symptoms that are commonly observed during the pandemic. But unfortunately, we could not account for REM sleep in our study.
Thank you, Jeremy. Next question is for Heather. Heather, we know that there are 3 COVID vaccines available here in the United States. From your perspective, is one causing more side effects than the other? Is that important for people to not only know, but then try to steer away from that? Can you just talk about the side effects and the differences across the 3 vaccines?
Sure. I know there have been some rare but serious side effects that have, been discussed regarding the Johnson & Johnson vaccine as well as the Moderna vaccine. And what I want to emphasize is those were very rare and very few instances, and it is really still not known if it is the vaccine that is the true correlation, or is it just happenstance because some of these adverse events are occurring at a similar rate as they would in the general public. So I would say for the common side effects, they're all very, very similar. And I can say that if you're getting a 2-dose vaccine series, it is more common to have more side effects after the 2nd dose. Or if you have previously had COVID, your side effects might be a little bit more severe. But otherwise, in my opinion, they are very similar across the board between the 3.
Thank you, Heather. It looks like another question came in, Kelly, in the chat. I think this next one's for Isaac. Do you mind handling that one?
Sure. So they're asking about some of the machines that you can do where you're not necessarily getting fully up and moving, but it's only working part of your body. So the bicycle pedals that you can sit on the couch and work, or maybe something where you're just doing it with your arm movement. Do those count when you're not doing full physical body movement?
Yeah, that's a good question. Yeah, it definitely does. So, I mean, essentially, if you're just defining what exercise is, you're really just creating more movement with your body and you're raising your metabolic rate. So, I mean, if you're moving your arms continuously, it counts. It's physical activity. Now, I mean, it kind of you base your physical activity based on your intensity. So, I mean, it may not be a super high intensity if you're just really lightly, pedaling and sitting on the couch with your arms. And so, you may want to do intervals where you're getting a little bit higher intensity now and then, just to sort of raise that metabolic rate a little bit more will probably have greater effects long-term for your health. But yeah, I mean, if you're, any way that you can find to move, it counts.
All right.
Great question. Thank you, Isaac. We're just about to the end of our town hall tonight. Time flies, right, Kelly, when we're talking about all things COVID-19 and trying to get the information out. I wanted to just close by giving each speaker just maybe 10 or 15 seconds here, just a one-line key takeaway message that you have for our community members. So Kate, since you were the first presenter, we'll have you go, that key takeaway message from tonight. Oh, and then Kate, we'll have you unmute again, one last time.
The key takeaway tonight is, COVID is with us for the foreseeable future, and we need to take all steps possible to protect those in our community that are vulnerable.
Thank you, Kate. Heather, we'll go to you next and go right through the Hollywood squares here.
Sure. So for me, the key takeaway is information is always changing. So I don't think it is safe to say that anyone knows everything. So strongly reconsider maybe some of your points of views on being vaccinated and, look at the available information. And I strongly recommend that people do consider becoming vaccinated.
Thank you, Heather. We'll go to Dr. Bombard next.
I think one of the most important things to remember is that COVID is certainly a part of our overall health picture, but everything else that used to be part of what we consider to be healthy is also there too. Making sure that we are social, making sure that we are having new experiences, that we are getting exercise, that we are doing the things we enjoy. That's all very important too. And making sure that we check in on each other and help all of us to feel more back to normal. That's one of the keys. We're all in this together.
Thank you, Dr. Bombard. Jeremy, go ahead.
All right, I would just say to try and maintain as best of a schedule as you can for that sleep and wake cycle. And then in addition to that, just practice, your key sleep hygiene. Keep your bedroom for sleep, go to bed at a consistent time, get some activity throughout the day, just to maintain that sleep quality throughout the rest of the year here.
And we'll finish up with Isaac.
All right, I would say regular physical activity, very important for your overall health, especially right now during the pandemic. We're not all the way through it yet, so it can kind of help keep everybody around you a little bit safer if everybody's physically active, and try to stay active beyond the pandemic too, because it's always going to be really important for health, not just now.
Okay. Well, thank you to all of our presenters, just in closing here, for all the hard work that you're doing. Also coming on the town hall and sharing the information, answering questions from the community. I want to thank my colleague and co-host Kelly Cam for coming on and providing the expert input analysis along the way. Recognize our sponsors one final time. UP Health System Portage, Aspirus, along with their Iron Area Health Foundation, the MTech Smart Zone, Upper Peninsula Power Company, and the Physiological Society. Also, thank you to the Health Research Institute. Just to let you know, our next town hall will be the final Thursday of June, so look for more information. We'll be rolling this right through the summer. A couple of final things. If you happen to miss any of tonight's town hall, just to let you know, it'll be on ABC 10 at 11:30 a.m. Eastern this Sunday, and our recording will be up on our YouTube channel, our website here in the coming days. So thank you for tuning in tonight and doing your part to stay informed and help us spread this information in a good manner to our family, friends, colleagues, neighbors, students, and everybody in our community here. So have a good rest of your evening, and we'll see you next month.
Thank you.
Bye-bye.